Hello. You're welcome to Diet Guide with Zugreen. Yes, you're welcome to Diet Guide with Zugreen. And today's topic will be discussing dietary management of gestational diabetes, that is pregnancy-induced diabetes. This diabetes actually for those that are pregnant. So that's why that's why the word gestational diabetes comes in. That's pregnancy-induced diabetes or pregnancy-induced high blood sugar level. Okay, depending on how you understand it. So, like as I said in my earlier video, we actually talked about gestational diabetes, but we didn't really go into details. So today, if you're here with me, please stay tuned as we will be talking intensively, at least to a very large extent, what we're supposed to eat when we are pregnant with gestational diabetes. Now that brings me to what is actually gestational diabetes. Gestational diabetes is actually a pregnancy-induced diabetes whereby your body is no longer or less sensitive to insulin. Okay, when your body cannot really make or use insulin, because of your hormonal changes at the moment. And what is this insulin? This insulin is actually what helps to transport the sugar or whatever it is that has been broken, that we eat and that have been broken down into glucose or sugar, as you all know, into the cells. Now, because of your hormonal changes at this stage, that's at the stage of your pregnancy, you get to notice that the food you eat that's supposed to be directly go into your cells is actually getting stopped into the blood. Why? Because the insulin that's supposed to help take it into your cells is no longer functioning properly, or is actually not really available enough for the body to make use of. And this actually happens as a result of your hormonal changes. So these are the reasons why, if you are in that category, you have to actually listen to what I have to say. Okay, so the dietary management of this particular diabetes. Okay, now before then, okay, we'll need to talk about what actually is the risk factor to having gestational diabetes. Let's say you're a woman or a mother trying or wanting to conceive, or you're already pregnant already. What actually can make one, predisposes one into having gestational diabetes? One, if you're already overweight before you go into pregnancy, you can actually have gestational diabetes. Okay, if you are aged, age can contribute to one having gestational diabetes. If you are maybe you've given birth before that is so big, you can actually be predisposed, like baby, or overweight babies you can actually predispose into having gestational diabetes. If you already have diabetes before, you can have diabetes in pregnancy as well. If you have a family history of diabetes, these are some of the factors that can actually predispose one into diabetes. And your lifestyle, what you eat, even if you don't have this diabetes before, you can actually have it. That's why we call it pregnancy induced. Okay, you can actually end up having diabetes during pregnancy, and most times it is get to known when you are around your 24 weeks and above. You get to see this whole diabetes of a thing start actually showing up. Even if you don't really actually have it, you necessarily did not really have to have diabetes before you get to find out that this pregnancy has given me this particular problem that I need to actually manage. Okay, now if you don't take care of this, what can actually happen? You are putting yourself and that of your baby in danger, because what you eat is what your baby feeds on. Whatever you eat, whatever you do affects you and that your baby. You get, in the period of that your pregnancy stage, it can cause you to have an overweight baby. It can make your baby go blind or not see or have vision problem. It can make you go through cesarean section. So that's why you need to listen, and you can even make that child to be a type 1 diabetic child, or even have diabetes as he or she aged in future. You see somebody when he started getting to like 40, 45, before you know, they will start diagnosing the person to have to have type 2 diabetes. So these are the factors that you have to consider and listen very well if you don't want to be in that category. Okay, fine. Now, like as I was saying, I already talked about the risk factors. Sorry, I had to actually cut to do one or two things. Now, aside having your child in this, or aside your child being predisposed to all these factors that I have listed, aside that, even you, the mother, you have a chance of getting type 2 diabetes in future. Although when one have gestational diabetes, after your delivery, it actually disappears. Immediately you drop your child or your baby, the diabetes thing actually clears from your system. But it is advised that after 6 weeks of delivery, you go back and check, so that you get yourself being checked and monitored. Okay, so that in case it wants to occur, you get to find out on time, then you'll be able to manage it. Because the fact that you already have gestational diabetes, there is a chance or tendency that you're going to go into type 2 diabetes. That's just it. Okay, so that's why what you eat is very important, and that's why we come in. I'm actually trying to put this out there because I don't want anybody to be a victim of hearsay, because during pregnancy there are a lot of people that will come and be advising you here and there, telling you need to do this, you don't need to do this. Most especially those with gestational diabetes, they start avoiding some things to eat that are not even supposed to be avoided, and be eating those ones that are supposed to be avoided. So as a nutritionist, I am here to tell you that you are in a safe hands with the information I'm going to pass for you for free. Please make sure you watch this video to the end. Okay, now the first thing first I'm going to talk about, we're going to be talking about what to avoid now, and what to eat if you have gestational diabetes. Okay, now the first thing first I'm going to talk about is your sweets. Anything that concerns sweets, Tum-Tum, Milkles, what else, whatever sweets or sweeteners or your sugar should be out of what you take. Sweeteners, sugar, honey. If you have diabetic in pregnancy, if you are diabetic in pregnancy, these things are not for you. Even your honey is not for you. Okay, please, I know we have cravings, but we have to know that, okay, this thing we are going to fight it till we deliver. So sugar, it is not for you. Okay, now the other thing we are going to talk about that is not yours is our tea. Oh, sorry, before tea, let's go into packaged drinks. Because of cravings, you see, packaged drinks is not for you. Even no matter how the craving comes, you have to be able to kill it out. Okay, you see, your packaged drinks like your Chivita, your 5 Alive, your Coke, your malt, your anything mineral, packaged sodas, they are not for you at this stage. Okay, please, let's avoid it when you have gestational diabetes, because these things are empty calories, and they're very, very simple sugars that can actually trigger and go into your system, into your blood very fast, because it doesn't have anything that can help you to do what? Slow the rate at which it enters into your blood, because your insulin is no longer as okay as before, due to what? The hormonal changes in this your condition of what you call pregnancy. Okay, so we need to avoid it totally. No more Coke, Fanta, malts, Chivita, anything packaged drinks, packaged juices is not for you. Okay, now the other thing you need to avoid is your tea. No tea, any kind of tea, no tea for now. Your Bonvita, your Milo, your Ovaltine as well. If you can even check the nutritive factor of whatever it is that you are buying, you see the amount of sugar packed in those things. Even like your Coke that I already mentioned, if they give you the sugar inside one bottle of Coke to lick, you'll be scared of it because you will not be able to sit down and lick it finish. Okay, so please, that's the reason why I am telling you this. Please just let's just watch this video. It's going to be very, you're going to learn one or two things from what I'm already saying or what I'm saying right now. Okay, now I talk about your tea. Please, no tea for you. Now, no full cream milk for you as a mother that is carrying that beautiful pregnancy of yours with gestational diabetes. Full cream milk is not yours for now. Okay, now the other thing I want to look out for in I actually list them down here is your milk. Okay, your milk, I told you no full cream milk. Now your meat source, no matter the meat you're going to eat, you're not going to eat anything that has to do with tozo, pomo, intestine. No what? Pomo, tozo, intestine. Okay, you can eat the muscle part of your meat. You can eat the eye, you can eat the tongue if you can, you can eat the ear of the meat if you can, no matter the animal. No matter the animal, guys, no matter the animal. Okay, be it your beef, be it your cow meat, or your beef, rather, anyone you want to call it, or your goat's meat. Please, let's do with the muscle parts. You can eat the muscle part because definitely as a pregnant woman, you need your meat too. You need your meat, but eat the muscle part of any meat you want to eat, and you can get the muscle part from the lap of the meat. When you go to the market, tell your meat seller that this is the part you want. Now your chicken, you can eat your chicken. Okay, but if you have to eat your chicken, you have to what? Deskin it. You have to deskin your chicken. Now let me go back to the aspect of your drinks. Now I told you no packaged drinks, no Coke and all that, but the best drink for you at this moment of your pregnancy is water. Water is very essential. You can take a whole lot of water and you'll be fine. Okay, let's do more of water. Okay, now I'll be talking on I don't want this video to be too bulky, so I'll just be picking it one after the other. But if you want an intensive class, please feel free to send me a DM. Okay, I'll definitely attend to you. Please, I need questions. Whenever you watch this video, please make sure you ask me questions, okay, concerning any problem, any health challenges that has to do with how you are going to feed. I'm right here to give you the appropriate answers to what, not hearsay from non-professionals. Okay, now I'll talk about your oil intake. Now your oil intake, I can prescribe some oils for you that you can use. You get, we don't need anything like that has to do with cholesterol. Now the oils that you can take your canola oil, you can take olive oil, you can use ground soya oil, which other oil that is very sure of? You can use any of these 3 oils, you're good. You can choose one and buy, you're good. But now the fact that I say you can choose any of this oil doesn't mean you go and pack the oil in your food. Now the kind of food you'll be cooking now, oil will not be visible at all. So now that boils down to frying, because your oil intake is going to be very, very minute. You are going to do what? Avoid what we call frying. Any type of frying at all, it is not for you. Down to your stew, you're not going to fry your stew. You're not going to fry akara. Neither are you going to fry egg or yam to eat. Okay, anything frying, do your hand like this. Anything frying. Say Zugreen said anything frying like this is not for you at this moment. Okay, so that being said, that no to frying, even your akara, like as I said. So aside that, now the oil content in your food, now if you're cooking for a family of 4, right, you can use 1 flat kitchen spoon. But if you're cooking only for yourself alone, you're not going to consume more than 1 tablespoon of oil. Okay, pardon the sound though, I'm actually inside where cars and all that are passing. So you're not going to be using more than 1 tablespoon of your oil regardless of what you're cooking. Okay, so that's why you don't need to go into frying is not for you, because now when you fry, let's do this mathematics now. If you put an amount of oil, like 1 cup of oil, when you want to fry like your yam, after you fry your yam, when you turn that oil, the remaining oil that you used to fry, into the cup back, it's not going to get filled up. And where will you find this oil that is reduced from the quantity that you've put before? It's from the food that you've already done, that is the fried yam. So you're consuming it, that means you're consuming enough oil, and which we don't want right now, because your system doesn't really need anything that has to do with fat, enough oil for now. Okay, we need something that is very high in fiber at this moment, because fiber is going to help you to slow down the rate at which the sugar level is getting into your blood. So that's why our fiber intake is supposed to be increased. Okay, so I'll be telling you what that you can get your fiber from, so keep listening. Okay, now I'll be talking on our seasonings. Please, if you are the type that like plenty seasonings in your soup or your food, you have to reduce it to natural spices. Okay, but that natural spice is not going to include your garlic or ginger for now, because sometimes it can cause some women to go into contraction or bleeding during pregnancy. Okay, so these are just the 2 spices I will not advise any pregnant woman to go into at the moment, okay, till you deliver your baby. Okay, now the other thing I'm going to talk about is your canned foods. Canned food like your sardine, your tomato paste. You don't need tomato paste. If you want to use your tomatoes, you go directly into the market and get a fresh tomatoes and take. Now it now boils down to, we're going to our fruit section now. Our fruit intake is not going to be more than 1 fruit per day. And what do I mean by 1 fruit per day, and how well can we combine our fruits and vegetables? Now, we can combine our fruits and vegetable by simply using, like for example, okay, first of all, what are the kind of fruits? Because there are some fruits that you're not meant to eat as at this moment of gestational diabetes that we're talking about. 1, the type of fruit you're not supposed to take in pregnancy induced diabetes is your pineapple. Is a no for you at this stage. Your ripe pawpaw, your watermelon, your pineapple, watermelon, pawpaw, your oranges is going to be very, very sparingly, if need be, depending on the percentage of your sugar level, how the ranges you're actually having at the moment. Do you get? Because sometimes we take oranges out of it at all, that you don't need it. But you can take your apple, you can take your carrot. If you want to take carrot now, you only take 1 medium size of carrots. You can take your grape, but grape is going to be more than 2 to 3 balls of it, or what will I call it? 2 to 3 balls of it, if I can use balls as the name, if I can call it like that. Now you can eat any other fruit aside your pineapple, watermelon, pawpaw, because why? They have high glycemic index. Okay, even your banana, you're going to leave banana for now. Banana is not for you. A woman that has diabetes in pregnancy, banana is not meant for you. Okay, banana is not meant for you, like at all. Okay, so now if you want to take your for example, now you want to take your apple as a woman with gestational diabetes, what do? You take your 1 apple, You can only eat one type of fruit per day. You can't eat fruit salad together anymore. Like now, you take your apple, you start getting your carrots, or you start getting the every other fruit combined together and eat on it. If you do that, it will increase your what sugar like this. So you don't do that for now. What you do is eat one fruit per day. If you're going to eat apple, it's going to be one apple per day. If you're going to take orange, you're going to take one orange per day. If you're going to take carrot, you're going to take one carrot per day. And how will you combine now your carrot and your fruits and vegetables? If you want to eat your fruits and vegetable, you eat, for example, you take one carrot to 3 garden egg and 1 cucumber, mix together and eat. That's how you'll be able to take it. Are you understanding me? So you're following back. So like as I said, 1 fruit to 3 garden egg, even 4. You can take 4 as well. It depends on how well you want it. You can make it in form of smoothie. You can actually, cut them into a plate and eat. Never you eat your fruits alone without adding vegetable to it. So now when you're eating your fruits, you must follow it with your vegetable. You can eat it together like this, or you dice, or you blend it and eat. Anyone that is convenient for you is fine. Now you can also do what we call I've talked about smoothie. Okay, so these are some of the things you need to do. Now you can eat any type of leafy vegetable of your choice. So now the thing now is, when you're going to eat your carbohydrates, I'll come to the aspect of carbohydrates, but your carbohydrates, most time will you quantify it? So the fact that I don't know the level that you are in right now, I can't tell you this is the size you're going to eat of this particular carbohydrates. Okay, so that's why you should still seek counsel from a dietitian to quantify your food. Okay, or you ask me here, then we'll see your results and know how to quantify your food for you. I'll do that for you for free. I'm not going to give any charges for that. I just want to see you okay and not go through any stress before your delivery or put your child into risk. Okay, that's just my own little way of adding value to the society. Now your vegetable, you take it more than enough. Now your carbohydrates, the way you'll be taking it now, in as much as you cannot measure. Now if you eat a plate of food that is as big as my hand before, now that you are having this gestational diabetes, you're going to take this out of it. Then you only eat your food this way. Now the thing that is going to augment it for you now is your vegetable. You have your vegetable soup as much as you can, like 3-4 times that food you are eating. Okay, it will even help you to boost your PCV. Like, you will not need to go out there and be getting transfusion. Okay, so we are not praying for that, but in case, so your blood will be more than enough for you. So vegetable should be your friend at this stage. Okay, vegetable, your friend. Your garden egg and cucumber, you can snack with them, because when you start eating small food, definitely you can go hungry at any time and easily. Okay, so now your vegetable, so because you can go hungry at any time, that's why your garden egg and cucumber should always be your friend, should always be in your bag, instead of going to snack with your confectionaries. Like as I said, yes, confectionaries are part of what you're not supposed to eat, like your what's it called, buns, meat pie, and all those stuff is not for you at this moment with this condition. Okay, now instead of going to snack with confectionaries, your like the donuts and all that, you snack with garden egg and cucumber. You can always have them in your bag. Anywhere you go, you eat. Just going to be your own paracetamol and B complex too. You understand? You keep it in your bag. Anywhere you're going, you're hungry, you chew. Depending when you come back home or where you can get your food. Now you can eat more than 3 times in a day. You can even eat like 4 times in a day, but you're going to be eating small quantity. You're not even going to be eating up to your feast most time. You're going to eat small food, and eat variety of foods. Don't say because you're already having gestational diabetes you're going to base your food on beans alone. It doesn't work that way. So you can eat any carbohydrates of your choice, but for now you will limit your fufu or akpu, depends on how you know it. For now you leave it alone. Even your pounded yam, you can leave it alone, but you can eat every other thing. You can eat your acha, you can eat the best ones that are high in fiber, acha, tamba, oatmeal. You can eat all these ones, and you can even still eat your rice, you can eat your beans, you can eat moi, you can eat your but you're going to leave indomie. Please, let's avoid indomie for now. Then you're going to eat your rice, like as I mentioned. You can eat your yam, your boiled yam, but your boiled yam is not going to be more than 3-4 slices, medium, small flat slices. So then anything you are eating, whatever it is you are eating, make it colorful. Let there be enough vegetable, leafy vegetables. You can combine your ugu, your water leaf, even your utazi leaf together. You see, you enjoy it. Then you use more of local spices like your dawa and co. Okay, but like as I said, no garlic, so that you not bleed. Okay, so that's that about that. Okay, so we can't quantify here because I've not seen your result, but please, your food is now going to be like this. But your soup now, vegetable soup, is going to be like this. You see how plenty this bowl is, but your food is just like the so once you finish eating the food, that is carbohydrate, now you lick your vegetable, you eat your vegetable. By so doing, what it will actually help to do in your body is that it will help to reduce the rate at which that food that you've eaten, whatever food you eat, like as I said earlier, it will still boils down to your what? Glucose, or your sugar, as anyone you can call it, you get. So this fiber, this enough vegetable you're taking will really help to slow the rate at which the thing enters into your blood. You get, it will slow down the rate. You don't just bombard it into your blood, that it will now start giving you excess taste, excessive urination and all that, and other factors that can happen to your child. Like as I said, it can lead to losing of your sight, or predisposing that child into having what? Type 1 diabetes. You give birth to a child, before you know, everybody will start running up and down to get insulin because he has to survive. So to avoid all those things, these are some of the little things you have to just avoid for yourself. What you eat now is key. Then you drink a whole lot of water, go to toilet and it goes off. Now if you are allergic to vegetables, like if you eat vegetables and it makes you stew, let me know as well. Then I'll know the type of vegetables I'll prescribe for you. You can eat your okra. Okra is also vegetable, but the soups now you're not going to eat. Thank God I remember. The food you're not going to eat now, you're not going to eat your bono soup and your melon, your egusi. Leave those soup alone. Pomo, leave it alone. Like as I said before, you're not going to be using vegetable like this anymore sparingly. Your vegetable is not going to be like your main dish, your main food. Why the other ones are small? Then with your meat or your fish, you can eat any kind of fish of your choice, in as much as it's not fried fish. Okay. Now I'm going to talk about your exercise. Exercise is important, but I'm not saying go and run or go and start jumping fence. No, you can take a walk. You see that when you walk under the sun in the morning, that early morning sun, you're even helping yourself not to predispose that child in having jaundice. Okay, we're going to talk about jaundice in our next class. Anytime I am free to come up online, we'll talk about why do jaundice actually occur in children, and what to do to avoid having your baby to having jaundice baby. Okay, but for now, your early morning workout is very good. 30-minute walk is fine for you, so make sure you include exercise. Very, very important. Exercise, very, 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 very important. Okay, I guess we understand that exercise is also part of it. Now let me break it down again. The ways we can actually curb gestational diabetes, to actually manage it, that's diabetes in pregnancy, is with your diet, if necessary your drugs, insulin if necessary, and exercise. These are ways you take care of it, this condition. So no one goes out for another, but every other one can actually stop because you are controlling what you're eating. So it's just depending on the level that it is at the moment. Like as I said, who are those that can have this issue? If you are overweight before, if you are already pre-diabetes, if you have family history, you should watch it. Okay, now if you are even a mother planning to go into pregnancy journey, you have to take this into consideration by reducing your weight and getting your normal weight. Don't be overweight, because overweight or obesity can actually predispose you to having gestational diabetes. Okay, please, let's take note. So with this little point of mine, I hope I'm able to give you some informations. I hope you're able to get some informations from your diet guide. Please, if you have any question, don't hesitate to ask me. I can't actually explain everything here, but please make sure you come to the comment section below and ask your questions. Please, I want questions though. Please let me know what you feel, so that you encourage me whether to continue or to stop wasting my time. Okay, please ask me questions. I love you as always. Always love from me to you. Okay, love from me to you. So see you in my other class. Okay, bye for now. Make sure you're joining my live. Once I come up on live and I do my videos, I will take it off. I will not save it, so whoever actually participated will be able to gain much more. Okay, my number is on my page. Check it out and buzz me, or you send me a message on Facebook. I'll definitely see it and I'll reply to you. Okay, I wish you safe delivery. I wish you all the best, and I wish you having a healthy baby. Okay, I love you as always. Bye.